Hi, I'm Tom Eschen, and this is the award-winning Power in Politics podcast. The conversation about the issues that are impacting you the most with the officials, the advocates, members of the community that are making those decisions and sparking change at the same time, too. Today we sit down with two individuals at that, two officials at that here in New York State, in the state capitol at the same time. Dr. James McDonald, the health commissioner, along with the acting director of the Office for the Aging, Greg Olsen. We talked to them about the master plan for aging. It was unveiled just a couple weeks ago, much anticipated. Advocates were calling for it, and they got it. So now people are reacting to it. So we asked them exactly what it's addressing when it comes to New York's aging population, affordability, housing, everything in between, and now how the federal reconciliation plan and some of the cuts that are coming there impacts all of that, the entire continuum of health care when it comes to those in New York State. Thanks as always for joining us. We appreciate it. You can listen wherever you get your podcasts at Power in Politics or watch on YouTube at CBS 6 Albany. Well, we appreciate this interview today talking about the master plan for the aging. We had the Commissioner of Health here in New York State, James McDonald, Dr. James McDonald as that, and also we have the Acting Director of the Office for the Aging, Greg Olsen. Guys, we really appreciate your time. Obviously, this was a long, concerted effort amongst so many agencies. Hundreds of pages, more than 100 proposals at that. First, your takeaways from the process, and tell us a little bit about your perspective on what came out from this plan. We'll start with Dr. McDonald.
Yeah, so really, I think first time you've seen every state agency involved with hundreds of community-based organizations, private enterprise as well, really working towards one goal, which is how do we age in place in New York State? How do we make aging simpler, healthier, more affordable? And it's important to have the North Star because we all want to age. I want to age in New York. I want to have my final days in New York State. It's great to have a place to do it, and it was great to see how this worked out together. By the way, a lot of work over the last several years. This was no small thing for the Department of Health and State Office for Aging.
Yeah, first I just have to plug Governor Hochul for having the foresight to really put this together. The leadership of the Department of Health under Commissioner McDonald, the agencies as he talked about, but we had over 420 stakeholders, 20 public events, did 2 surveys that reached over 180,000 people. And if you look at polling, right, when 38% think this, 40% think that, the sample size is usually about 400 people. We had 140,000 responses on what older adults thought about themselves, their communities, what they wanted, et cetera. So I know some people were frustrated with the time frame, but 18 months to do all this work across agencies to get what the public thought that they would want to see in New York from a policy perspective to tie all this together was really monumental.
I know as a part of the plan, there's pillars, there's points of emphasis. What did you guys learn? I guess there's something that maybe you, and obviously you're the in this area of expertise, but what's something that stuck out to you?
So the 9 pillars are important because you have to have boundaries and groupings around the plan. And the 9 pillars are important. One of the things that was interesting to me was technology. I think we all take now technology for granted. It's how we do commerce, how we get entertained, it's how we learn. But technology is a real barrier for a lot of people in the north part of New York. Broadband internet access is really important. That's one of the things that was a surprise to me. One of the things that wasn't a surprise to me, though, was another pillar is healthcare workforce. You really see a lot of stakeholders highlight that. We really need to make sure our healthcare workforce is ready. Now, the Department of Health, we've been doing a lot with healthcare workforce. We have over $700 million we have committed in our 3 workforce innovation organizations across the state to get more people into healthcare, and not just for the aging, for everybody. But when you look at who needs healthcare for our future, it's the 65 and older crowd.
I think the pillars for me are a really great way to organize content. Nothing really came out to me as a surprise. I think what has come out in this document and what people really pulled together is that older adults and their families don't touch one system. They're not just at the Office for Aging or the Department of Health. A couple of examples, the Adult Protective Services is in OTDA, Office of Temporary, or OCFS, I'm sorry, SNAP and HEAP is in OTDA, and we can go down the road. So, being able to connect the agencies, the community agencies, the advocates, and the residents themselves to look at aging holistically so that we can serve people better, prevent them from, hopefully getting sick, and to be able to improve their overall outcomes, because aging really isn't the problem. It's the way that our country has organized the caring economy. And what this does is really starts to look at how to shift that to support people where they want to be. And as Dr. McDonald said, over 90% of people want to remain in the state and they want to remain in their own homes. I'm always curious to who that one person is that doesn't, but he's spot on with that. This is an opportunity to kind of look at how we can reshuffle things and make life easier, access easier for every New Yorker, regardless of where they live.
I think it's interesting you speak to the population that this addresses and is the point of all of this, but also the other populations impacted. And this is something I brought up in my other conversations with other stakeholders and those that have been involved, is that, quote, the near unavoidability of caregiving. I thought that really stuck out because I think it touches on a lot of what it's all about. And you see that reflected in some of these proposals, whether it's an official healthcare worker or it's an unofficial family member caregiver. I feel like that's accounted for here, right?
Yeah, I think that's really one of the things, when you think about aging in place, what we're hoping to do is age in your place. And that means you get hopefully as old until you have your last days, right? My dad, God bless him, is 94 and a half. Right now, he doesn't have a caregiver, but he lives in an independent living community. Communal meals, that works for him. My mom's in a nursing home at 89. That was the best setting of care for her. But for a lot of people, they want someone in their home. And it really gets to, is it a formal healthcare worker or is it informal caregiving? And how do we train for that? That's really one of the things that people brought us. How do we train for that? Because it's really interesting to me. There's also this sandwich generation. In other words, a group of people taking care of their children, but also taking care of elders. That's new for the United States. That's something that happens in Japan, where I lived for 2 years quite a bit. But this is new for us.
And I fit that category, actually. And I'm glad you asked that question because we have a formal system that's really important. And what I think this is trying to do is build a continuum. But we have 4.1 million people who are providing uncompensated care to somebody else. They're the number one providers of social services, number one provider of long-term care, and they're hugely important in healthcare. And I think one of the things we didn't talk about, we often talk about what we do, right? Whether it be our agency, Dr. McDonald's, or others, how we do it. But we don't talk about why. We live in an ageist society, and one of the reasons the governor did this is because she recognizes the value of the older population. This is a population that supports 7 million jobs. They pay $72 billion, 40% of state and local taxes. Many are still working. Their GDP is $739 billion a year. We have 1 million people volunteering their time at 500 million hours of service at an economic value of $13.2 billion. Helping to hold up 3,200 not-for-profits around the state. I could go on and on with home ownership, et cetera, that supports local Medicaid, supports schools, supports local businesses. And to Dr. McDonald's point, we want those, the economic, social, and intellectual capital to stay in New York because you wouldn't have a local, regional, statewide, or national economy without the older population. And the governor recognizes that. I recognize that. Commissioner McDonald recognizes that.
There's obviously, this is a very layered approach. And I think a part of that, you mentioned this population, but also who's in the population. And you have the words in there, diversity, equity, and inclusion. Why was that a point of emphasis in this?
Well, when you think about who created the plan, our role as state agencies, we're the convener, the guide, we helped you do this. But really, when you look at who created the plan, it was all the stakeholders. By the way, there's nothing wrong with diversity, equity, and inclusion. We are different people. I like being around different people. I learn things from different people. Equity, what it really just means is meeting people where they are. Not everybody needs the same thing. It's about customization. And inclusion just really refers to we're too isolated, folks, but we really want to include everybody in this. And I think one of the pillars you see, by the way, in this report is talking about the isolation. That's a product of, to some degree, the technology, but a product of our culture. And it's not just the elderly who suffer with isolation. It's all of us to some degree. But I really think one of the things about who created the report, it was all these partners who came forward. They talked about diversity, equity, and inclusion because this is a concept that's real and it matters to people.
My job, as well as others, is to serve all New Yorkers from every part of the state. We are required under federal and state law to serve the hardest to serve. And that includes people of color, people in rural areas, people who are low income, and that's always going to be a priority of ours, and it's a priority of the governor's. On the tech side, I think Dr. McDonald is absolutely right. We lead the nation at the New York State Office for the Aging. We have 33 tech partnerships combating social isolation, helping people with dementia, exercise programs, strength training to reduce falls, scam and fraud mitigation. I could go on and on. We're serving millions of more people for pennies on the dollar. So tech is a huge part of the solution. It's not a replacement for a human being, but it's absolutely a tool in the toolbox.
I think the big question some might have coming out of this is how is it going to make things more affordable when it comes, I know housing is a big proponent, it's a big pillar as well, but just in terms of the continuum of care and the world that this population's living in, how for you or me is it going to make it cheaper to be able to have my parent, my grandparents to live in a way that is going to support them?
So the MPA is really a starting document, as Dr. McDonald said. Our job was to facilitate a process. So that the report has just come out. Now it gets bigger, right? It goes to the governor. The legislature is going to look at it. Other state agencies are going to continue to look at things that are doable in the foreseeable future. We have a lot of uncertainty at the federal level, so this is going to be an ongoing process. But one of the proposals to specifically address what you were talking about is one entity or entrance place for benefits that people are eligible for. There are millions of people that don't take advantage of benefits. So I'll give you three just for the aging population. The Medicare Savings Program, if we can get individuals to apply for that, around $2,300 a month, we can put between $7,000 and $8,000 back in their pockets. You add SNAP to that. For the average older adult, the average benefit per year is $2,600. And then HEAP, Home Energy Assistance Program. Those three alone will increase the purchasing power of an older adult by $11,000 a year if you're low income. So that's just one example. On housing, governor's had a $25 billion 5-year housing plan, but we're a home rule state. You can't build housing, even if you have the money, if local municipalities don't change the zoning. So there's proposals in there as well, which is why it's so great to have Paul Byer, the Smart Growth Director, as part of the leadership team, because that's what the Department of State does, is they train localities in terms of their planning and their zoning, and we need zoning changes in order to build the 880,000 housing stock that the governor has put forward.
Yeah, of course.
So let me build on affordability as well. I think Greg summarized it really well, but here's an example. We need to find a way to make healthcare more affordable, right? You look at what's happening at the federal level. I'm not feeling the love from the federal government right now, but how do you make healthcare more affordable? When I look at nursing homes, one of the things you saw in the plan, people call this out, medication aids in nursing homes. We're one of the few states that doesn't let a medication aid pass a med in a nursing home. That means we have to pay more nurses to do that. But how do you make things more affordable? Sometimes it's letting people do what they're trained to do and influencing scope of practice. But it's part of how you make healthcare more affordable. One of the things we need to be looking at very seriously in New York State is we have to find a way to help nursing homes and hospitals reduce their costs because there's less federal money coming.
Yeah, I guess that's the elephant in the room, right? I think this was released on a Monday, and 3 days later, or that same week, that the reconciliation plan passed, and now we have another budget coming, of course, in the fall. When it comes to the legislature, when it comes to the funding methods of this, whether that's incentives or whatever it's going to be, how do you wrestle with that? Do you think do things change at all after you unveiled this plan?
So I think the annual budget process next year will be very interesting, a lot more dynamic than I think usual. I think when you really think about where the federal government went, which I think is just really interesting, if you look at the whole federal health policy, research at National Institute of Health was cut. Many federal agencies were cut. 17 million Americans are going to become uninsured. There's a broad-based attack on fluoride to protect our teeth, broad-based attack on vaccines. The federal government's health policy approach looks a little bit odd to me. Like, I don't see them heading in the direction of making anybody healthy again. I don't see that. What it really makes sure we have to focus on, and this is where I think New York needs to really focus, is how do we keep New Yorkers healthy and improve New Yorkers' health and well-being? This is where the annual budget process needs to really focus on, if there's waste, how do we cut it? If there's something we do to make someone healthier, how do we do it affordably, and how do we move forward? Go back to the scope of practice conversation. There's things New York can do to make scope of practice not leading the nation, but just like every other state. For example, a medical assistant giving a vaccine. We're the only state that doesn't let that happen here. That's something we need to look long and hard on. It got some energy last year, but didn't get over the finish line. And I think where you get to with this is, How do you make healthcare more affordable? How do you make it lower cost? How do you get more people healthy? One of the things I want to focus on in New York State is how do I get more people eating healthier food? Fruits and vegetables, real foods. If the food came from a farmer or a fisherman, I'm all for it. It's the baker I worry about, because once that baker gets involved, they process the food a little bit, and that concerns me. But I think really a focus on eating well in New York and eating to be well in New York.
Is that where policy can come into play from the legislature too, to have, you mentioned the zoning regulations, things like that can actually help undercut, I guess, or help make up for some of those cuts?
Well, I think we have to look at this whole thing holistically. First thing is we don't know what October 1 of 26 is going to bring. So you had mentioned we only have one, the reconciliation bill at this point, and its impact on Medicaid, its impact on SNAP. We still have 11 other appropriations bills that fund my agency, Dr. McDonald's, Department of Transportation. So we don't know where we're going to be, and then we'll be able to do an analysis. So I don't want to pretend like we have the facts, because we don't. The best way to save health and long-term care costs is not to wind up in the systems that are most expensive and to prevent it. And that there's a lot of proposals in here that do exactly that. So, for example, one of the proposals was to significantly increase funding to the New York State Office for Aging, because we can serve people who are at risk of emergency room visits, hospitalization, observation status, Medicaid spend down, nursing home placement, and help them remain independent for 5 to 7 years at under $10,000. We still are spending more than 90% of healthcare and long-term care costs in the most expensive setting. So one of the ways to curtail those costs is to provide the community-based infrastructure that's going to support people. And there's a lot of proposals in here that call for that. But as Dr. McDonald said, there's a budget process. I think we'll have a lot more information between October and December. And then we'll go through the normal process and hopefully make the best decisions we can on behalf of all New Yorkers.
I think that's what I've been hearing is that, even during this process, is the advocates and everybody else involved had said that the point of all this is to prevent getting to that next threshold of where it will be a strain on some of those other services, instead helping people stay healthier quicker. One more for me before we go here is about oversight to all of this. And I know the Inspector General, if you saw, she posted an editorial recently asking for more funding. It's for the State Long-Term Care Ombudsman Program. I know there's $10 million in there for this. Lucy Lang was a big proponent of getting more professionals in there, and it's been a very volunteer-based program. How important of that as that in this process?
Well, I think, and I saw the op-ed, and she's fantastic. We talked quite a bit about the LitCop program, among others, when I met with her. When you talk about what's happening at the federal level, in the HHS budget proposed to OMB, they proposed to eliminate the Long-Term Care Ombudsman Program nationwide, proposed to eliminate Adult Protective Services nationwide. So I think highlighting the partnership that the Long-Term Care Ombudsman Program, our office, has with the health department, ensuring quality care in facilities, is really, really important. And so we'll be taking a look at that. The governor and the legislature have increased the LitCop budget the last 2 years. That has led to an additional 80 full-time staff rather than relying on volunteers, because the volunteer corps is changing, whether it be EMS, firefighters, the Long-Term Care Ombudsman Program, and others. So we're really building capacity. It would be a shame to deteriorate that capacity that's been built here in New York.
Awesome. Thank you both for your time. We appreciate it.
Thank you.
Thank you.
Thanks for listening. Hit the subscribe button right now so you can stay up to date on these news-making conversations about the issues impacting New Yorkers the most: power and politics.